Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Miliary shadow, which is seen on the chest X-ray, and we're looking at its causes. So here, in terms of miliary shadow, they are nothing but innumerable. So they are innumerable. So it is innumerable and it is small. So it is innumerable and it is small. By small we mean it is about 1 to 4 mm, and they are nothing but the pulmonary nodules. So it's pulmonary nodules which are present, and it is scattered throughout the lungs. It is scattered. So it is scattered throughout the lungs. And where it is seen? It is seen in terms of, seen in the MTB, that is a miliary TB. Then comes the histoplasmosis. So we're writing it as histoplasmosis. And there is the sarcoidosis as well. So sarcoidosis. Next comes the pneumobiliosis, the pneumoconiosis. So the pneumoconiosis, it refers to the coal workers with the pneumoconiosis, and the silicosis. So it refers to the coal workers with the pneumoconiosis as well as the silicosis. Then there is the healed varicella which is present. Healed varicella is also a component. And the long-standing MS. Next is there is presence of long-standing MS. Long-standing MS. So long-standing MS, it can lead to the pulmonary hemosiderosis. So it leads to nothing but the pulmonary hemosiderosis. Then we look at the healed varicella. There is something known as the healed varicella. So then there is the long-standing MS. There is something known as the long-standing MS. So long-standing MS, it can lead to the pulmonary hemosiderosis. So long-standing MS, it leads to the pulmonary hemosiderosis. And then comes the alveolar microlithiasis. The alveolar lithiasis, as well as the papillary and the medullary carcinoma of the thyroid. So there is papillary as well as the medullary carcinoma, and this is of the thyroid. To learn and grow daily like this, please do subscribe.